The guardrails are off. So when the guardrails are off, anyone left that has any thought process or mental capacity to do their jobs professionally, they get fired.
The Department of Health and Human Services announces the director of the CDC is out. Ann Thompson is with us now. And Ann, you have some late-breaking details here. Do we know what happened?
Tom, it is a mess. HHS says Susan Manaras is out as director of the CDC, but her attorneys say she has not resigned and has not received notification from the White House that she has been fired. In a statement, her attorneys also say that she refused to rubber stamp unscientific, reckless directives and fire dedicated health experts. NBC News is also reporting that 4 other top CDC leaders are resigning. Manaras, who was appointed by President Trump, spent just a few weeks in office, weeks that were marked by that horrific shooting at the Atlanta headquarters.
So now RFK Jr. is firing anyone that's left responsible in the CDC. And then since that's now the commissioner there who was against following quack orders and unscientific approaches and agendas, and then refused to resign because I guess she felt the need to still try to be there to have some kind of competency left in the department, they get rid of her. And as you heard at the back end, other folks decide to leave as well, which kind of sucks. Here's more details as to this firing and also the departures of these other professionals that know what they're doing. From NBC News, the leadership crisis at the CDC erupted the same day the Food and Drug Administration announced new limits on who can get the latest approved round of COVID vaccines that I was just talking about. Here, Susan Manaras is not aligned with the president's agenda of making America healthy again. That's what the spokesman Kush Desai said in a statement. Since Susan Manaras refused to resign despite informing Health and Human Services Department leadership of her intent to do so, the White House has terminated her from the position with the CDC. Because, that's a tough guy thing to do. Get rid of the person who's still thinking. Here's more from that. When CDC Director Susan Manaras refused to rubber stamp unscientific, reckless directives and fire dedicated health experts, she chose protecting the public over serving a political agenda. That's what her attorney then also said. And then he said for that, she's been targeted. And here's the other folks that are leaving because of it, which is kind of sad because it's leaving more openings for more yes men and stupid people to be there. 4 other officials also submitted their resignations on Wednesday in a massive shakeup at the agency. Here's those folks. Dr. Deborah Oury, the CDC's chief medical officer. Dr. Dimitri Deskakis, director of the National Center for Immunization and Respiratory Diseases, and Dr. Daniel Jurganen, the director of the National Center for Emerging and Zoonotic Infectious Diseases. Also, Jennifer Layden, who's the director of the Office of Public Health Data, Surveillance, and Technology. I can't even pronounce some of their positions or names, but they know what they're doing. Oury, in a resignation letter obtained by NBC News, wrote about the dangers of the spread of vaccine misinformation and said proposed budget cuts and reorganization plans would negatively affect the CDC's ability to address conditions like hypertension, diabetes, cancer, overdoses, and mental health issues. In his resignation letter, also obtained by NBC, Deskakis said that he was leaving the agency because of the ongoing weaponization of public health. These folks can't sit by because then their powers and their abilities to do their jobs are getting stripped. So their names will just be attached to all of this madness, all of this death, all this destruction. And they probably have, these principles within their minds where they're like, I can't be a part of something like this. And if they stay, they probably just fight this fight and still lose it and then eventually get fired anyway. But we're listening to RFK Jr., brainworm guy. There was also a post about who some of these resignations came from. One of them was Dr. Dimitri, as I pointed out. I want to just give you guys a couple of quotes from his very long resignation letter. Dr. Dimitri said, "This decision has not come easily, as I deeply value the work that the CDC does in safeguarding public health, and I'm proud of my contributions to that critical mission. However, after much contemplation and reflection on recent developments and perspectives brought to light by Secretary RFK Jr., I find that the views he and his staff have shared challenge my ability to continue in my current role at the agency and in the service of the health of the American people." And he said, enough is enough. Here's details of what it is that he was dealing with. Here's the last quote from him, I promise. "I'm unable to serve in an environment that treats CDC as a tool to generate policies and materials that do not reflect scientific reality and are designed to hurt rather than improve the public's health. The recent change in the adult and children's immunization schedule threatened the lives of the youngest Americans and pregnant people. The data analyses that supported this decision have never been shared with CDC, despite my respectful requests to HHS and other leadership. They just make pause. They've been making things up, and they won't share their made up assumptions like what RFK Jr. was doing at the beginning with SSRIs, with people who know what they're doing, because they know that people that know what they're doing are going to say, this is stupid. All right, continuing on from his resignation letter. This lack of meaningful engagement was further compounded by a frequently asked questions document written to support the secretary's directive that was circulated by HHS without input from CDC, subject matter experts, and that cited studies that did not support the conclusions that were attributed to these authors. Having worked in local and national public health for years, I've never experienced such radical non-transparency, nor have I seen such unskilled manipulation of data to achieve a political end rather than the good of the American people. Just listen to the people who've been there. Listen to the people who have, so many lives have been saved and changed. We've got the actual evidence.